Good afternoon. Good afternoon. I apologize we're a few minutes late, but it's good to see everyone here and good to know that you're all at home watching. I think we've all become accustomed to the 1 o'clock hour as our time to be together as a community and share information about the virus and how Rhode Island is doing. The answer is we're doing very well, and I'm very proud of you. It's because of your actions and the way we've come together as a community that Rhode Island is faring much, much better than other states around the country who are starting to see surges, hospitalizations going up. And so I just want to say thank you, everybody, for following the rules and doing your best, even though it's been incredibly difficult. We are going to continue these Monday, Wednesday, and Friday at 1 o'clock. So we'll be back on Friday at 1, and then again Monday at 1 o'clock. I want to thank the members of the press who are here. I've thanked them a few times through this. Most of them haven't gotten a day off since this started, and they've played a more important role than ever, I think, in this virus, keeping people informed, which means keeping people alive. And so I want to thank you guys for all that you've done. We will begin, as we always do, with a quick picture of the data, and I'd ask you to please put that up on the screen. As you can see, it's another good picture, another steady day. 49 additional cases to report. Very sadly, another 11 deaths. It's every day we get up here and report deaths, and that means every day, every one of us just has to pause and remember how deadly this virus is, and just say a prayer or send a thought to the family of someone who's lost a loved one, because we continue to lose Rhode Islanders every day. Having said that, in general, the picture looks very good. You can see it yourself. Hospitalizations continue to decline. Our statewide test positive rate is just about or under 2%. That's fantastic. It wasn't that long ago I was up here saying it was 20%, 20% of the people we tested were positive. Today, about 1.5%, 2% of the people we're testing are positive. That's fantastic. And we're testing more people than ever. The national average of what percent of a state's population that's been tested is just about 8%. This week on Friday, we believe we're going to hit a huge milestone in Rhode Island. We'll be the only state in the country that will have tested 20% of our population. We're within a whisper of it now, and we think by the end of this week, Rhode Island will be the only state in America that can say we've tested 20% of our population, as compared to the national average of 7 or 8%. So why am I sharing this with you? Because if you're sitting at home and a lot of you are still nervous, and I know many people are still afraid, and I understand that, you should know that we are testing more people per capita than anywhere in America, higher than many countries, and our test positive rate is among the lowest in America. So that doesn't mean the virus is gone. It just means we've gotten used to living with it, and our results are very good. So I hope that you are starting to feel confident and more confident, confident to go out for dinner, confident to send your kids to camp, confident to go back to church or synagogue or mosque, confident to resume your daily living routine, which is so important. We have been in phase 2 for about 2 weeks, and so I'm frequently being asked, what will phase 3 look like? I plan to dedicate the Friday press conference this week to looking at what phase 3 will look like. So if you're interested to know what the new regulations will be in phase 3, tune in Friday at 1 o'clock, and we're going to begin sharing that information. I have taken the approach where I want to tell you, I want to start previewing for you what phase 3 will look like, even though we're still weeks away from phase 3, so that you can get prepared. So if you're a small business or your family or run a summer sports league, tune in Friday and we're going to start to give you some news about what phase 3 will look like. Today I just wanted to just take a second and address, just give a preview from my vantage point of where we are, where we've been, and where we're going. And it's meant to address a question that I get often, frequently, all the time actually now, which is, governors, this is the way it's always going to be. Is this the quote unquote new normal? You know, will we be wearing our masks forever? Will my kids, you know, forever not know if they'll be able to go into regular school? Will we never be able to bring back everybody to our workplaces? So let me offer a few thoughts on that. This is what I would say. I don't like the phrase, the new normal. I don't think this is the new normal. I actually think we should set our sights higher to say that we're going to rebuild a better, stronger, healthier, more equitable, more resilient Rhode Island. I don't want to come out of this a year from now. We hope, we think, we plan to have a vaccine and a therapy. So we're not going to be living the same way we are now. We're going to have a vaccine. It'll be a different situation, a different threat. But we aren't ever going to go back to the way it was. There's never going to be normal the way it used to be. And it's on us to make sure that the way it is in a year is better than it was a year ago, because we've learned a lot going through this. So I'm not saying that this is fun. I know there's a lot of people out there struggling and suffering. And if you're unemployed, I promise you we're going to get you back to work. And if you're housing insecure and you're struggling, we're going to do everything we can to make your lives better compared to where they are now. But I am saying that I am committed to, and asking you to commit yourselves to, taking what we've learned in this crisis, the good parts of it, and making a Rhode Island a better Rhode Island on the other side of it. So, for example, we've learned that there is a permanent and forever role for distance learning and virtual learning in our K-12 public schools. As we said last week, it's the end of the snow day. Sorry, Foster Gloucester and all the kids. You're not going to have snow days anymore. You're not going to miss learning. You're going to stay home and do your work in a distanced fashion. And we now know you can do it in a great, excellent way and learn a lot. We've learned that telehealth really works. It's a fantastic way to deliver healthcare over the phone or over video, where you can provide access to healthcare in some ways at a lower cost, just as high quality, for people who have a hard time getting to the office, getting to the doctor's office. It's not a replacement. Let me be clear. Virtual, I am getting these kids back to school in the fall, but they're going to continue to rely on distance learning because we've learned many kids thrived with it. The same thing with doctor's offices. I am not saying you're not going to go visit your doctor again. You will. There's no substitute for in-person visits for certain things. However, if your choices are missing an appointment or having an appointment telephonically, or you can't get the bus or a car to the doctor, I'm going to work with the legislature to make sure that telehealth is permanently reimbursed in the state of Rhode Island. A month or 2 months ago, I signed an executive order requiring insurers to pay for telehealth the same way they do for in-person visits. Let's make that permanent. We know it's working, and it's breaking down barriers to access. The same thing is true for working from home. You know, many people have continued to work from home through this crisis. And we've done a survey of businesses. 90% of businesses say that their employees are just as productive working from home as they are in the office. So we need to enable that, which means we need to think about childcare for folks who are going to continue to work from home. Same thing about in the state. You know, Director Smiley's done a terrific job making it so that a lot of our employees can work from home. We're going to continue that. That could be a way to reduce cost, reduce real estate costs. We might not need as many buildings, but allow the people's work in the state to continue. The DMV might not go back to the way it was. I'm sure that will be relief to some of you. You know, we've been operating very well by appointment only. Lots of people have said to me, Gov, don't go back. Now it's been in a limited fashion, so obviously we would have to make changes, but this is the kind of thing that we're gonna look at. DMV by appointment only, never waiting in line again. I don't know if it's possible, but it's certainly worth striving for. So, you know, I think these are just a few examples, and I'm not going to go on and on, but I offer them to say this, to provide you with some hope. It's a lot of folks out there who are losing hope, and I understand that. Right now, we're in the thick of it, we're in the teeth of it. Unemployment is at a historical high. There's anxiety about what summer will look like, anxiety about what school will look like, and that's all normal, and we're going to get through that, just as we have. But I want you to start to get a little excited about the ways in which Rhode Island could be better in the future if we apply the lessons that we've learned through this time. And I would invite all of you to start thinking that way. It's changed. This economy is forever changed. There are going to be forever changes to retail, brick and mortar retail, forever changes to hospitality. And that's scary to hear if you're in that business. But what I want you to hear is we're going to embrace that change. We're going to retrain you. We're going to build on, we're going to rebuild this economy bottom up and make it better, stronger, and more jobs than we went into it. But it isn't going to be the same. But by now, we've all learned how to live with change, and we've gotten better at being flexible. I'll also say this. You should feel very proud as a Rhode Islander. You take some pride in the Rhode Island response to COVID. You've been better than really any other state I can find. Our rate of compliance with the rules is through the roof. The way our hospitals reacted quickly and turned on a dime was best in class. Our testing is best in class. The way you've reached out to help neighbors is amazing. The way our nursing homes have complied, our veterans home, just the way people have reached out to lend a hand. Rhode Islanders have united. We have benefited from the fact that we're small and connected and everybody knows everybody. That's going to help. That's helped us to get here, and that's going to help us to rebuild. So if you're feeling down or discouraged or worrying, I want you to feel confident. We made it this far. We're doing better than any other state. It's still tough, but we are going to stay united and rebuild together. And I have every confidence that we are going to be successful. And when we finally have a vaccine, you know, that'll be great. But also, I think our economy and our healthcare system and our educational system and the way we deliver state services is going to be even better than when we started this. And I'm looking forward to that. I said today that I was going to address high density communities. And so I'd like to do that for a minute or two. So I said earlier that we're doing remarkably well with the virus, and Dr. Alexander Scott will touch on this. The statewide percent positive rate is very low, just under 2%. But if you look around the country, this is really important, if you look around the country, around the world, at the states that are getting into trouble, you know, where they're seeing hospitalizations start to climb, spikes in cases, more often than not, their statewide percent positive was good, but they had pockets of outbreaks. So in Texas, 45% of their new cases are in their prison system. In other cities and states where you're starting to see spikes in hospitalizations, it's because they have one county, one community, one set of nursing homes, whatever, one geography, where there was an outbreak happening and they didn't put a lid on it fast enough. So from this point forward, it's actually, I think, in some ways more important that we keep our eye firmly on these densely populated communities and communal living communities and big employers like manufacturers where people work closely. It's really important that we keep our eye on that, because you could have a 2% test positive rate in the state, but an outbreak happening under your nose in a particular community. And so to that point, our team starts every day and ends every day looking at the data in certain communities where, frankly, we've been struggling to get the test positive rate where we need it to be. We know in poorer communities, immigrant communities, and densely populated communities, the virus thrives. And frankly, that's not hard to understand why. Lots of low-income folks have had to continue to go to work in offices, out of their home, in a grocery store, in a nursing home, etc. So they've been exposed. Then they come home to a crowded apartment, maybe a multi-generational crowded apartment. One person gets sick, before you know it, the whole family's sick. They're all living closely together. It's a reality. So we have had to really focus extensively on these communities. We are making sure that our contact tracers are multilingual. We are making sure we increase testing in these communities. We are trying hard to increase awareness in these communities, breaking down language barriers, and we're trying to take a very individualized approach. What works in Central Falls is different than Providence, is different than Pawtucket, is different than Woonsocket, and frankly, certain neighborhoods in Providence are different from one another. The truth of it is, every community is different, and so we have to, the beauty of being small, as we are in Rhode Island, and connected and knowing our communities, is we can be personalized in our approach, and I think that's a huge reason why we've been ahead of the curve compared to some other places. So let me tell you specifically today about a few things we're doing. I want to tell you about the results we're having and make a few new announcements. So with respect to testing, we've been bringing testing into the neighborhoods that are most affected. And specifically, we're working closely with community health centers to bring testing where it's most accessible to the most people. In many cases there, we have created and we continue to create, as recently as today, creating more walk-through sites and drive-through sites. So if you live in Central Falls, Providence, Pawtucket, Woonsocket, North Providence, please consider getting tested. Definitely get tested if you're sick. And if you don't have a car, I promise you, if you live in one of those communities, there is a testing site close enough for you to walk to, or call, or go to the community health center, and we'll figure out a way to get you tested. Secondly, we have our health equity zones. Dr. Alexander Scott has been a leader on health equity zones for 5 years, but we are further investing. That's healthcare in the community. And then contact tracing, the people from the Department of Health and the National Guard who do the contact tracing, we've really ramped up our efforts to make sure that we have multilingual people who do the contact tracing, who are representative of the communities, oftentimes from the communities that they're engaging with. And I want to give a big thank you to the Latino advisory group that I created months ago. They put this firmly on our radar, which is, if you're going to be doing testing in contact tracing in Central Falls, the person on the phone should, maybe come from that community, speak the language of the person on the other end of the line, and have an awareness of what's going on. So I cannot say this enough. If you are hearing me, if you live in Central Falls, if you live in the west side or south side of Providence, if you live in Pawtucket, if you live in Woonsocket, if you feel sick, if you think you've been near someone who has had COVID, please, please get tested. Don't worry if you can't pay for it. Don't worry about your immigration status. Don't worry if you don't have a car. Call the community health center, call the Department of Health, use the Crush COVID RI app, but we want you to get tested because we need to keep our eye on, we need to keep you healthy, and we need to, make sure that these communities are safe and we don't have any kind of an outbreak. Now, to that point, I want to give you some data. So our percent positive rate in Central Falls today is in the low teens. It's about 13%. 2 weeks ago, it was 22%. 13% is too high. We have to get Central Falls test positive below 10%. So we have to do more testing. But if you're listening to me and you're nervous, in a couple weeks, we've gone from 22% to 13% in a very densely populated community. That's good progress. So thank you. Let's keep going. The percent positive rate in Providence has been below 10% for a few days now. It was about 18, 19% at the end of May. That's a big relief to me and should be a big relief to you. It's our capital city. We have to keep all neighborhoods in Providence below 10%. It's a large population, and we're there. We're there, and we have to stay there, and we have to drive it lower. Pawtucket, doing a great job in Pawtucket, has been steadily at or below 10% for the past few weeks, so that's reassuring. Breathe a sigh of relief. And in Woonsocket, we've seen a slow decline, steady decline over the past few weeks, and we're now consistently testing at about 6%, whereas we were at 15% in Woonsocket a few weeks ago. And big thank you to the community health centers in Woonsocket. So I want to say this. These numbers are a point in time. They will fluctuate, but they are all good news. This is all good news. And it's all directly related to the fact that the people in those communities have come out to get tested, and that we are totally committed to bringing care to the community through the things I said: testing, health equity zones, and contact tracing. And I'm going to continue to talk about this. This is what we need to keep our eye on: nursing homes, congregate care settings, densely populated cities. When the students come back, dormitories. These are the areas that we have to keep our eye on. In addition to the fact that we've seen a decrease in new cases, part of the reason we're seeing a decline in the percent positive statewide is because we've started our new asymptomatic testing program, testing people who don't feel sick. It's an early warning system, as we've talked about, and we want as many people to have access to this as possible. We want to be testing large volumes of people who are not sick. People are, I think, confused by this. They're saying, why would I get tested if I don't feel sick? We need you to get tested even if you don't feel sick. It's free, because we need to know roughly how many people in our population have the virus or have been exposed to the virus. So to that end, today I'm announcing that we're adding new asymptomatic testing sites in communities. Eligible Rhode Islanders without symptoms will be able to get tested at 4 Stop and Shop locations across the state. These locations are in Cranston, Pawtucket, and the two stop and shops in Providence, one on Manton Avenue and one on West River Street. So Stop and Shops in Cranston, Pawtucket, Manton Avenue in Providence, West River Street in Providence. Testing will take place every Thursday, Friday, Saturday, and Monday, and we have capacity to run 30 tests per day at each Stop and Shop location. This is in addition to the 900 we want to be running at CCRI and Rhode Island College. So I'm going to remind you one more time. If you are a child care worker, a barber, a hairdresser, cosmetologist, work at a gym, exercise trainer, physical therapist, any kind of personal service worker, public transit driver, a bus driver, a restaurant worker, if you've attended a large protest or big group gathering or any kind of demonstration where there's a lot of people that you were near and you stayed for a while, we would ask you please, even if you feel great, even if you don't feel sick, we would ask you please to go get tested. You can make an appointment at the Stop and Shop sites or at RIC or CCRI by going to portal.ri.gov, or you could call the Department of Health 222-8022. It's really important that we do this. Think of it just as like doing your part. Throughout this whole crisis, people have constantly said to me, how can I help? What can I do? I think my answer to that question now is go get tested. Portal.ri.gov. If you work in any kind of business where you're in close contact, or if you've been to a protest or a large group gathering, please go get yourself tested. It's going to help. It might not help you specifically. You're probably going to be negative if you feel fine, but it'll help the rest of Rhode Island, and it'll help us keep everyone safe. It'll help us move to phase 3 quickly. It'll help us move beyond that. It'll help us get the kids back to school. It's exactly what we need to do. So I'm asking you please to consider doing it. Okay, with that, I'll turn it over to Dr. Nicole Alexander-Scott and then come back for questions.
Thank you, Governor. Good afternoon, everyone. Thank you for being with us here. To get started with data in terms of our numbers for today, we have 49 new cases that have been reported. There are currently 126 people with COVID-19 in the hospital. Of these 126, 17 are in the intensive care unit, and 13 of those 17 are on a ventilator in the ICU. Sadly, we have 11 new COVID-19 associated fatalities to report. 6 of these people were in their 70s, 2 of them were in their 80s, and 3 were in their 90s. I just ask people to find a moment at some point today to pause and remember all the Rhode Islanders who we have lost throughout this pandemic. To transition, I want to thank the governor for her leadership when it comes to our focus on communities that are more densely populated, on communities of color, and the variety of scenarios that she mentioned where we need to keep our focus strong. For the high density communities, I also want to acknowledge Mayor Grebian in Pawtucket and Mayor Diosa in Central Falls, along with their teams, for their tremendous work. We recognize that those mayors and many across Rhode Island are facing some difficult circumstances. And all things considered, they and their teams are doing an amazing job. The high density communities work that the governor outlined is starting in Pawtucket and Central Falls as a partnership with those communities. And we will expand into the other high density communities mentioned in the very near future, already making plans towards that. I also want to recognize Julian Drix from the Rhode Island Department of Health and the entire team across all of the work streams who have been focused on this partnership from the state side, starting with Pawtucket and Central Falls, and we will continue to expand from there as mentioned. As we've been saying for years, our work to address health disparities has been going on well before COVID-19 and the pandemic started. We have been able to take advantage of that fact and help take steps forward quicker as a state because of our existing health equity zones collaborative infrastructures. We have health equity zones in all of the cities that we've mentioned that are considered most densely populated. Starting with Pawtucket and Central Falls that has one unified health equity zone. To just explain a little bit further what it's about, Health equity zones are made up of residents, community groups, healthcare providers, housing advocates, people in education, people in municipal leadership, and many others. While health is a part of the model, we are clear about saying it's not just the healthcare piece. It needs to look at all of the factors that contribute to someone being healthy living in a community, what their housing is, what their education is, what access to fresh fruits and vegetables they have. The health equity zone model is about bringing these leaders from the community together and supporting their work to address the issues that they have identified as impacting their ability to live in a healthy community. When it comes to COVID-19, the vision is for the community infrastructure of the health equity zones to be a central focus that can expand and make sure to get resources to community organizations so that they can better serve the residents in those communities. It's a ready-made infrastructure already set to disperse those resources out to residents. Our health equity zones are also going to continue to be a major conduit of information for us so that we can continue a bi-directional flow of information, making sure that the community's voice is at the forefront. Whether it's support with housing or improving food access or addressing utilities, our health equity zones will be able to make us aware in real time about what people's needs are at the community level. In addition to having the health equity zones partner with us on resources and information sharing, we also envision the health equity zones getting involved in our testing and contact tracing work as they've already begun. For example, health equity zones will be able to continue to support our case investigators and contact tracers in connecting with people who we have needed to reach. And our health equity zones are going to help us identify and overcome barriers when it comes to testing and contact tracing. They've already been instrumental in helping us get personal protective equipment and masks out to communities and families. What we want to continue to advance is having health equity zones continue to help us shape our ability to respond at the community level. They've told us where testing should happen. Something as simple as picking one site over the other for testing can make all the difference in terms of the numbers, even if they're only a few blocks apart. It's having that intel at the community level on the front lines. All this work is an exercise in balance. We're constantly balancing the need to take steps now to address the immediate impacts of COVID-19, while also addressing the structural issues that make people more vulnerable to COVID-19 in the first place. The example that's most helpful to share is housing. We know that people who have unstable housing and people who are experiencing homelessness are more vulnerable to COVID-19. For that reason, we've set up housing options for people who cannot quarantine or isolate right now in a way that's safe for them and their family. And as the governor announced last week through our Housing Now campaign, we're aiming to get people who are experiencing homelessness into at least 100 rental units. As we continue to act on these short-term immediate measures, we're also working with organizations like Rhode Island Housing and the Rhode Island Coalition for the Homeless on the larger issue of homelessness and the availability of housing and making housing secure. This has been an area where we have benefited enormously from the governor's leadership. This year, she's made work to expand the availability of safe and healthy housing for all Rhode Islanders a priority. This remains a focus for us and is even more critical through this COVID-19 response. This approach of addressing immediate needs while also focusing on larger structural solutions is present throughout all of our work, including what we're doing on employment and access to care and education. So before passing things back to the governor, I can make one last comment on that. We've been talking a lot in the last week about schools and plans for reopening. There's an intersection here with the needs and challenges in our communities that are more densely populated. While we are making things uniform and making it so that every child is able to return to in-person school on the same calendar, as the governor mentioned, we also know that communities are different and schools are different with different needs. And we're going to be working extremely hard along with our leaders and partners in education and very closely with our high density communities to make sure that students, families, teachers, and schools have the support they need to all move together in reopening. We know that all kids deserve an equal opportunity to be in school, to be learning, and to be thriving. And we're going to be very attentive and responsive to the needs of each community so we can ensure that this is happening in every zip code in Rhode Island. So with that, we will get started with questions.
While the case numbers are going down, there's still, as you know, the deaths. Is this again still attributed to nursing homes? Are you not seeing a significant improvement there? What can you say about the testing results in nursing homes and what the situation is there?
Our percent positive rate in nursing homes is continuing to decline. We are one of the few states that has been able to establish this very aggressive, proactive testing campaign across our nursing homes and expanding into other congregate settings. We are well into our 4th round of testing there, and with continuing to ensure that staff and residents have access to testing, it is helping us see the decline in the percent of people who are positive. This continues to take a comprehensive effort. Testing is an important piece, infection control is an important piece, making sure that personal protective equipment is in place and that the nursing homes and staff have the resources that they need. We're moving on all cylinders on all fronts to help continue to address what we need to in nursing homes and assisted living.
If I could just follow, is that where most of the deaths are still?
Yes, unfortunately, most of the fatalities are there. I can provide that number. Of the 11 fatalities that we announced today, 9 were associated with long-term care facilities. For the number of deaths in long-term care facilities, we have approximately 650, which continues to remain around roughly 75% of overall fatalities that exist.
Dr. Scott, of the people that are currently in the hospital, what percentage came from nursing homes for right now?
Let me get back to you on that number because it fluctuates continually.
Now, I'm hearing from a lot of people, how easy is it for someone in a nursing home to get tested? A lot of children are questioning their parents, and for some nursing homes, it doesn't seem as easy. How often would you like to see people be tested who are currently in a nursing home?
We have the aggressive comprehensive testing program that I just shared earlier, which is aiming to test all nursing home staff, offer that testing to them every 7 to 10 days. So we are well into our 4th round of that testing. We want to make sure that every staff person has access to that testing. We have been including residents in the first couple of rounds, but to also find the balance with comfort for the residents, we're shifting towards reserving additional testing for the residents if there is a cluster of cases and we need to identify further what's occurring.
Could you just give guidance to if there is someone in a nursing home that wants to be tested? Is that something that should be readily available, or seemingly more as maybe the relatives of the person in the nursing home getting this message they'd like to see them have the ability to get tested more often?
Yes, if that is something that a family is interested in for the resident, because we are doing the cyclical testing, certainly continuing for the staff, If a resident volunteers that they want testing done, that is available to them.
Dr. Scott, in Politico today, there was a story saying that across the country, nursing homes are not being routinely investigated for how they're complying with COVID. How is Rhode Island handling that?
Yeah, we've known that nursing homes in Rhode Island and throughout the country have had challenges with COVID-19. Obviously, that's what we have been discussing. There have been some individual homes that may have had infection control issues cited in previous surveys, but the challenges that they have faced with COVID-19 have had much more to do with how infectious this virus is and the fact that people in these settings are more vulnerable. What I would say for how we are addressing it here in Rhode Island is there is an extremely close relationship and coordination with leadership of nursing homes and their staff. We're communicating on a regular basis. We have inspectors and members of our congregate care setting support team that are at the ready to go into nursing homes and really provide that balance of helping to ensure that the quality continues, the quality of care that we all want to make sure is in place for residents, and that is there, while also helping to ensure that they have the resources they need to implement the infection control requirements.
The question is there a regular program of inspections going in to see if they are COVID compliant?
Yes, there is. That program occurs based on what the needs are and the requests are. We have inspectors. We've worked with CMS to ask for even more inspectors to be available to go in. We respond to phone calls on a regular basis, as we have done ongoing leading up to this. And as I was mentioning, we have the additional congregate setting support team that is able to go in on the mission to address infection control, cleaning, PPE needs, and testing needs on a regular basis.
To that point, do you plan to extend the deployment of the National Guard and then beyond July 1st? And then how much of a role does the National Guard play in that nursing home, whether it's testing, inspection, and so forth? In other words, is this going to be extended well into the summer?
The National Guard has been invaluable in what we've been able to achieve, particularly with the congregate setting support team and all of the work that continues with that. We are using this time, knowing of the extension with the National Guard that is in place. We're using this time to very deliberately and strategically transition that work to the staff that will be able to continue that. We're developing that plan now. We know that this is going to be a long-term resource that we want in place. We're grateful to the National Guard for really standing this up and putting together such a quality program, and we intend to continue it even with the National Guard transitioning.
If they're pulling out, so to speak, July 1st, and at that time you'll transition, or what's the timeline, I suppose, that you're working with right now?
Yeah, we are working closely with the general. Don't have the specific date of that transition, but want to make sure we do it in a way that ensures we'll be able to continue the same quality program. They're not just going to leave and not have that in place. We're already making sure that that's set up appropriately.
Governor Raimondo, James Bissett, Providence Business News. You made mention earlier about talking about phase 3 on Friday. So this is kind of like a little bit on that point. R1 indoor karting in Lincoln reopened on a limited basis last weekend. And among their reasons, they're citing Twin Rivers reopening as one of the reasons why they're reopening, saying, if Twin River can reopen, why not us? So this is a two-part question. Is R1 in any potential violation of state protocols for being open in advance of phase 3 guidelines being issued by the state? And how should similar entertainment facilities that have been awaiting phase 3 guidelines proceed, given that R1 is now in limited operation right now?
I am not familiar with their business model, and I'm reluctant to go business by business from the podium. The regulations are online. They are crystal clear. I'll have the Department of Business Regulation go to R1 and make sure that they are in compliance. And if they are, then they're doing nothing wrong. If they're not, DBR will explain to them how they have to change the way they're operating.
So basically, it would have to be DBR's call to say if they can be open at this time or not, even though it's.
Yeah, I
indoor
mean, I
recreation.
don't know exactly what they do, but there's really detailed guidance online, reopeningri.com, as it relates to pretty much every business. So if they are following the guidance, you know, imposing mask wearing and the like, then they're probably doing nothing wrong. If they're not, then that's a problem, and we'll send the inspectors out and deal with it.
So if R1 is in compliance as an indoor recreation facilities and other such facilities, if they reach out to DBR, do they get the possible okay to maybe open in this type of period? Right
I
now?
would say so let me say, if there's any business out there right now who's confused, am I allowed to be open? Am I not allowed to be open? Under what conditions? The first thing you should do is go to reopeningri.com and look and see if there's anything there that applies to you. If you're still not sure, call 521-HELP, get on the phone with somebody from Commerce, or call the Department of Business Regulation and just ask them, you know, this is the nature of my business, this is what I'm planning to do, is it okay? So that would be my guidance. It's you know, we have tens of thousands of businesses and different kinds of business, so it's not possible for me to sit up here and give you the details. But I think everything online is clear. If it's not clear, just call 521-HELP. We want to give you a hand, ask them, and we'll help you out.
Okay, thank you.
Governor, just a couple of questions. You're encouraging folks in these high-density communities like Providence, Woonsocket, to go and get tested. I just wanted to be clear, is asymptomatic testing now available to folks in high-density communities, or do they either have to be sick or fall into one of those industries?
Yeah, great point. That,
Okay.
sick or fall into one of those industries.
Okay.
So,
Even if they're in a high-density
Yeah.
population, if they
Yeah.
don't have symptoms and fall into one of those categories.
yes, at this point, yes. What the doctor just said is coming next will be even broader asymptomatic testing. But the program we're running right now is all the close in contact businesses. I would say this, we're not going to turn you away. If you work in a close in contact business and you feel like you want to get tested, go get tested. Tell us the business you're in and get tested if you don't feel sick. But with the Central Falls communities, if you feel sick, that I was trying to hammer home. If you live in Central Falls and you have the sniffles, you live in Central Falls and your neighbor was tested positive, you live in Central Falls and you, I don't know, think you don't feel good, you have a headache, you have a fever, please go get tested. And that was that message. But otherwise, if you're a waiter, waitress, you know, everything I've been through, we want you to go get tested. Soon, we'll do like broader testing in these areas.
We've gotten some questions from clergy. Can clergy come and get tested?
Yes.
The second question I had,
We want to be, more is better. We need data. We're falling behind. We're still not at 900 a day. Clergy are in a high density, close in contact business. So yes, if you'd like to come get tested, go get tested.
the other question I wanted to ask was about, you know, the doctor was talking about homelessness, home security. We've been hearing from the folks who have applied for the past due rental assistance. I think it's that roughly $6.5 million. That money has not been dispersed yet, and that they're having a hard time hearing from anyone, getting an update. So can you just tell us what the holdup is on those funds? And
I will look into it. I'm disappointed to hear there is a holdup, and I'll get back to you.
And just one final question. We're also hearing from, and I know this has been raised many times, and maybe it's something you're going to address on Friday, but venues that have large functions like weddings, like conventions,
Friday.
they're sort of chomping at the bit for information. Is that coming on
Yes,
Friday?
absolutely. Yep.
Governor, if I may, following off what Kim said on two fronts. First, on the asymptomatic testing, how often would you want these workers in close contact businesses to get tested? So if they do go get tested today, should they go back in 2 weeks again because they're still working at the salon or?
Yes, we are working on a cyclical repeat testing format for people who are high contact workers. An ideal is every week and certainly every 2 weeks. And it would be best if it's the same person that's interested in being able to do that. To add to what the governor said, with our high contact workers, we really want to also call out people who are high contact workers who live in high density communities. Definitely make sure that you go ahead and get tested.
And on the wedding front, Governor, again, I know you're saying it Friday. Connecticut came out today and said they're going to allow private outdoor gatherings of 100 people starting now. And sometime in mid-July, 250 people. And I've already seen that that's causing some unease in Newport because they think people are going to leave and go there. Can you say if you have something on Friday that will put them at ease? Or
I think so. That's the plan. We've been
looking for some guidance.
Yeah, just on Friday, that will be in the social gathering limit. There's a difference, we think, between going to a restaurant where you don't know everybody in the restaurant, and so there's not so much mingling, and having an actual event where everybody knows one another and there's a lot of mingling. So on Friday, we're going to talk about restaurants and also separately social gatherings such as weddings. And there's going to be a higher limit, and we are also thinking about the possibility of having a higher limit for outside versus inside. But I know Connecticut did that. I know New Jersey went to a higher number. And to be honest, I'm trying to strike a balance. I want to enable commerce. The wedding industry is a big business. It's not just the venue, it's the caterer, the florist, the makeup and hair and the whole thing. That's a lot of people. I want to get back to work. So we're trying to figure out how big is the typical wedding in the month of July? How big is the typical wedding in August? And we want to be able to enable as many as possible, to enable as many jobs as possible without, taking a risk of having some kind of a comeback.
Governor, with respect to testing, kind of circling back to that, or perhaps Doctor, folks who attended a protest, people who were packed on the Block Island Ferry, we saw these photos of maskless ferry goers over the weekend. Anybody who's been in a situation that there should be social distancing, but there wasn't, are they encouraged?
Yeah, go get tested. Yes, go get tested. If you found yourself, for whatever reason, in a close quarters with 100 people, whether that's at a protest or on a ferry or, I don't know, in somebody's backyard, go get tested.
Governor, what sort of contingency plans are being made for, say, the end of July, beginning of August? Because a lot of things are going to change then. The unemployment insurance arrangements will stop. A lot of the housing and eviction moratoria, the utility shut-off moratoria will stop. And a lot of, once the PPP loans to small businesses end on their term, there may be a lot of conversions from temporary layoffs to permanent terminations.
Yeah.
And I understand, of course, you're in some ways at the mercy of the federal government.
Correct.
But what is the state itself doing now to plan for those eventualities?
It's a great question, and it's something that I am highly concerned about and I'm working hard on. So everything you just said is accurate. The extra $600 ends the end of July. The PPP program ends the end of June. And we have a looming enormous budget deficit here in the state of Rhode Island. So let me tell you a few things. On the call Monday with the White House, the Vice President and the Cabinet, it's clear that they have no intention to extend the PPP deadline. So if you are a business in Rhode Island who is possibly eligible for PPP, I want to urge you in the strongest possible terms to go call your banker or call Commerce 521 Health immediately to see if you're eligible for PPP, because I do not think they're going to extend that deadline past the end of June. With respect to unemployment insurance, that's on the table. I know that there are many people in the Congress who are advocating for an extension of unemployment insurance. And I spent an enormous amount of my time lobbying Congress, the White House, Treasury Secretary, fellow governors, our own congressional delegation to fight as hard as they can for a stimulus, for federal government stimulus. So what we are doing, in fact, we had a meeting on this morning, is we're making contingency plans. Very bad scenario, no more stimulus. All the way to, another 1.25 billion from the federal government in a stimulus, which I think is quite likely. Everyone I talk to tells me that is quite likely. And our federal delegation is committed to it, working on it every day. So we're doing no new aid, $1 billion plus of aid, and then flavors in the middle. And that's why I've been, some have said to me that I should be pushing out the COVID relief fund faster. We had a discussion a week or two ago, or someone like, why aren't you giving it to small businesses today? And the answer is, I'm operating under extreme uncertainty. Nothing from the federal government to $1 billion more. So for the next few weeks, while we figure out and get some more clarity on what we might be getting from the federal government, I'm just making contingency plans and waiting a little bit and working to put pressure on the federal government to do the right thing.
Governor Cuomo today mentioned that he will push for New York to recognize Juneteenth as a holiday. I know the governor of Virginia said the same thing. Do you have any thoughts on that? Would you do the same?
I read that about Virginia, and it's a very, it's like something that we should think about. I hadn't heard of it literally until this morning. I mean, it's an enormously important day, and many would say it's not that different from the 4th of July. So I don't have plans. I hadn't considered it, but it is something I would consider.
Would you consider swapping VJ Day for Juneteenth as a state holiday, kind of kill two birds with one stone?
I don't know about that, but it's not VJ Day, as we know. But no, but I think it's an excellent question. I mean, it's something that's worthy of discussion. I think it's not that different from taking the name plantations out of Rhode Island's official name. I mean, this matters. This matters. And so it's all on the table, Brian, to answer your question. I'm spending a lot of time every day listening to people in the community, and all of this is on the table. We have to do more. Okay, thank you.